Hi, today we will learn fourth part of Domiciliary Care Fundamentals. It is about dementia and challenging behaviour. Let's start.
Hello and a very warm welcome. If you're a care worker or a care support worker, then you're in exactly the right place. This explainer is one about refreshing and sharpening those essential skills that help you provide the most compassionate and effective care possible for people living with dementia. So, let's dive right in.
Okay, so here's what we're going to cover. First up, we'll dive into what the experience of dementia is really like, to build our empathy. Then, we'll look at behavior in a whole new light, as a form of communication. After that, we'll open up our professional toolkit. And to finish, we'll look at how to put it all into practice with person-centered communication. Right, let's get started with Section 1, Understanding the Dementia Experience. You know, the foundation of really great care isn't just about the tasks we do, it's about why we do them. And that why really starts with putting ourselves in their shoes, with empathy.
So what exactly is dementia? It's a really important thing to be clear on. It's not actually one single disease. Think of it more like an umbrella term. It covers a whole range of conditions that cause some very similar symptoms, like memory loss and communication problems.
And this is where we see just how wide-ranging the effects can be. It's so much more than just memory loss, isn't it? It could mean really struggling to follow a conversation or completely losing track of what day it is. It might even be something as simple as having trouble judging the distance to a chair. And, of course, all of these changes can have a huge impact on someone's mood, often leading to feelings of frustration or anxiety.
Now just pause for a second and really think about this. How would you feel if you couldn't find your way home, or if a complete stranger was acting like they knew you? Imagine that feeling of pure confusion where your own world just doesn't make sense anymore. It's a really powerful way to start understanding the daily reality for the people we support.
And that experience leads right to the powerful emotions we often see. Feelings like anxiety, fear, and even anger. They're not coming from nowhere. They're often a direct response to that confusion we were just talking about. They're actually a pretty natural reaction to living in a world that suddenly feels unpredictable and, honestly, a bit frightening.
Okay, so knowing about that emotional side of things is the perfect lead-in to our second section, thinking about behavior as a form of communication. This is where we make a really crucial shift in our thinking. We stop seeing a problem behavior and start seeing an attempt to tell us something important. Before we go any further, it's good to be clear on what we mean professionally by challenging behavior. Here's the formal definition. And as you can see, we're not just talking about something that's a bit difficult. We're talking about behavior that's so intense it could actually put the person or others at risk.
And this, right here, is probably the single most important question you can ask yourself when things get tough. Instead of just reacting, we have to become a bit of a detective. We need to press pause and ask ourselves, okay, what is this behavior actually telling me?
And here's the absolute key takeaway. More often than not, what we call challenging behavior is simply a way of communicating. When words are hard to find, behavior is what's left. It's a person's way of shouting out that something is wrong, that some fundamental need just isn't being met. And understanding that, well, that changes everything.
So what kind of needs are we talking about?
Well, a lot of the time, they're the really basic things we all need to feel okay. Could they be in pain or just thirsty? Maybe they're feeling frightened or lonely or even just plain bored. If we can figure out which of these needs isn't being met, we can often solve the problem right at the source.
All right, let's move on to Section 3 and open up our professional toolkit. As care workers, we don't just rely on guesswork. We have really important legal and ethical frameworks that guide our practice and make sure we're always doing the right thing for the people we support.
And at the very heart of that toolkit is the Mental Capacity Act. Now, these 5 principles you see here, they aren't just good ideas. They are the law. We have to start from the assumption that a person can make their own decision, and our job is to do everything we can to help them do that. And that third one is so important. Just because someone makes a decision that we think is a bit unwise, that doesn't automatically mean they lack capacity. And this is a really critical point to grasp. Capacity isn't like an on or off switch. It's decision specific. So someone might be perfectly able to decide what they want to buy from the shop, but they might not be able to get their head around a complicated financial document. We have to look at their capacity for every single decision we're helping them with.
Okay, what about when we're faced with aggression? We have a clear model to follow called the public health model, and I want you to really look at what step 1 is. Prevention. That is always our number 1 goal. Building good relationships, creating a calm space, that's our best defense. If that doesn't work, we move to de-escalation.
And physical restraint, well, that is always, always the absolute last resort. And a brilliant framework that helps us with that prevention step is called positive behavior support, or PBS for short. This is what really brings everything together. It's about moving away from just reacting to behaviors and, instead, trying to proactively understand the whole person. What's their history? What are their needs? The whole idea is to create support that's tailored just for them, to improve their quality of life. And when you do that, guess what? The need for those challenging behaviors often just melts away.
And that leads us perfectly into our final section. And honestly, it's about the most important skill in your entire toolkit: communication and action. This is where we pull everything together: the empathy, the understanding of behavior, the professional frameworks, and make it real.
You know, communication is about so much more than just words. Of course, the words we choose matter, but it's also about our tone of voice, how fast we're speaking, and then there's all the nonverbal stuff. Our body language, our posture, these things can sometimes speak way louder than words, especially for someone who might be finding language a bit of a struggle. So here are some really simple but incredibly powerful techniques you can use every single day. A genuine smile. Getting down to their eye level so you're not towering over them. Keeping your sentences short and simple. And maybe the most important one of all, just be patient. Don't rush them. Giving someone that extra bit of time to find their words is a true act of respect and kindness.
And this is why it all matters so much. This is the heart of it. Good communication isn't just about getting information across. It's about making another person feel safe, to feel like they have some control, and most of all, to feel valued. It's all about dignity.
And that brings us to the end of our session today. I just want to say a huge thank you for taking this time to sharpen your skills. The work you do, day in and day out as a care worker or a care support worker, is so incredibly important. Your dedication truly makes a profound difference in people's lives. Never forget that.
Now, we always want to make these training sessions better, so we'd be really grateful if you could leave some feedback for us in the comments. And just to help you put all this into practice, have a think. What is the one single technique we've talked about today that you're going to make a real effort to use this week? Thank you again for your time and for everything you do.
Did you learn something valuable today? I will see you in next video. Thanks.